Hello, everybody. Thank you so much for being here with us on this gorgeous Atlanta afternoon, if you're in Atlanta or from wherever you are connecting from. I'm Maren McKenna. I'm a journalist and author and a senior fellow at Emory University's Center for the Study of Human Health, which is the sponsor of this author Q&A series, in which today we're hosting Chelsea Wald, author of the fantastic brand new book, Pipe Dreams: The Urgent Global Quest to Transform the Toilet, which comes to us from Avis Press and Simon & Schuster. Chelsea, thanks for being with us, especially since it is so late for you in the Netherlands. You look remarkably bright-eyed for someone who is up so late.
Normally, I would not be up at this hour, but I'm very, very happy to be here. Thank you for the invitation.
Well, thanks for joining us. I'm very excited to talk about this book. To tell the audience a bit about you before I start interrogating you. So Chelsea has been writing about infrastructure and sanitation and hygiene since 2013, when she first sort of plunged into this subject. I should probably say from the start that it's going to be really hard to avoid some of the more obvious puns. She was originally an astronomer with a degree from Columbia. She has a master's in journalism from Indiana. She is a member of a number of very distinguished professional organizations. And for this book, she traveled, among other places, to Italy, to South Africa, to Indonesia, and to Haiti, as well as the Netherlands, where she lives, which I am incredibly envious of. We should talk about that. And so we're going to talk about the book, about her process, and about the challenge of transforming sanitation and hygiene around the world, as well as some of the storytelling challenges inherent in writing about a topic so touchy for a lot of people. So Chelsea, let's start with, tell our listeners just a little bit about yourself, and especially I'm interested in how this book came to be. What attracted you to the topic?
Yeah, well, it wasn't something that I ever saw myself doing. I would have maybe even been like the last person my high school classmates would have voted as most likely to write a book about the toilet. I wasn't, I'm not a potty mouth. I never was as a kid, and never had a particular interest in this topic or in poop. So it's not that. I don't have, fortunately, I haven't had any gastrointestinal illnesses that brought me to this topic. So it was nothing like that. I've been a science environmental journalist since I graduated from journalism school in 2004. And I did, a number of different things, was a generalist, and then became a freelancer. And wrote, sort of progressively longer stuff, and was always kind of looking for a niche for myself. And in 2013, I got 2 assignments. These just came to me. I didn't seek them out. They were from editors, but they had this odd connection. One was about sanitation. And it turned into, it was sort of a broad, one of these broad assignments that's just like, look into this topic, see what you find. And it turned into a story about new ideas for technologies for contexts, low resource contexts where people don't have toilets or don't have good, safe toilets. A lot of you might be familiar with that, the Gates Foundation Reinvent the Toilet challenge, so that kind of idea. And then the other one seemed like it was a completely different assignment altogether. It was about cities and providing heat in cities and where we could get heat from, like low carbon heat sources. And one of the ideas was sewers, because we put a lot of heat into our sewers with shower water and washing machine water. And I just saw a connection there that really intrigued me. And after that, I just continued digging deeper, you could say, sorry, and looked into just all these different aspects of sanitation systems all over the world. I took some online courses, and I decided to make it part of my beat. And I also saw as a freelancer, I saw that not many people were really covering the topic very intensively. And so I thought it could make a good niche for me. And after a while, then I noticed that there was so much innovation happening for all of these different contexts, and that it really did deserve a book. And I was at a point in my life where I thought, this is a challenge I do want to take on. And so that's when I decided to pitch a book on the toilet. So that's the roundabout sort of odd way that I became the toilet girl.
So I'll ask you in a couple of minutes about some of the journalism challenges of reporting on this topic. But I want to do first a couple of pieces of housekeeping. First, I neglected listeners to say that our co-sponsor for this series is the Georgia Center for the Book. I profoundly apologize for that. They have been fantastic co-sponsors for this author Q&A series here at Emory, and I'm very grateful to them. And second, I want to remind all of you that we're going to be here for an hour, and you can ask questions at any time. We're going to take audience questions pretty much in the second half of the hour, but there is a Q&A function at the bottom of the webinar screen that you're looking at. You can put your questions into that at any time, and I will see them. I'm going to hold them, so if you put a question in and I don't ask it right away, please don't be concerned. I haven't forgotten about you, but I also don't want you to forget your questions. So if something occurs to you as we're talking, just pop that in there and I will get to it when we get to the open Q&A portion. Okay, that is my housekeeping. Let's get back to the questions with Chelsea. So I think the big question that we have to ask is the question that's implicitly posed by the title of your book, which is, why is it necessary to transform toilets? How, but also why should we aim for this mythical state that you describe as loo-topia?
Yeah, loo-topia. Right. I mean, I think that most people think that toilets are pretty great. And in a way, I mean, they are kind of these medical miracles that help transform life in cities and made them clean and healthy and helped make our lives longer. So I hold this in my head as a kind of paradox, not as a condemnation of the toilet as exists, but a sort of a paradox where on the one hand, we can be grateful for the toilet, what the toilet has done, and also ask a lot more of it going forward. So I want to give a very quick and dirty history of the toilet technology that we call that's known as the gold standard system, the one that, everyone thinks of when they think of the toilet, which is the flush toilet attached to the sewer system, attached to a sort of centralized wastewater treatment plant. The flush toilet developed over the course of the 18th and 19th century. So by the end of the 19th century, it was pretty much the toilet that we use today. It really solved the problem of stink in a way, and the water helped clean out the bowl, and it created a seal so that sewer gases and that gases from wherever the toilet waste was going didn't come back up into the room. And that was nice for people inside, but the problem was that the water then just ran out into wherever it went. So it would go into a cesspool, but those cesspools then sort of overflowed. And this is, imagine London. So the cesspools would overflow then with all of this water that went into it, or there would be sort of drainage ditches that it would run down, or there was a sort of disorganized network of sewers, and it would end up in the Thames in that way. And so the flush toilet actually made sort of outside life a lot more problematic, and that created the need for a comprehensive sewer system that took all of this water away, this wastewater away, and took it away from the city, which proved to be a really good public health intervention, and was copied all over the world, and Europe and North America in particular, and at that time. And there wasn't really a good solution for sewage treatment right away. That came about after 1914, when researchers came up with a process that's still the basis of wastewater treatment today, which is known as the activated sludge process, which uses microbes to treat the organic matter in wastewater. And the result of that is a liquid effluent that can be discharged into waterways, and a solid residue that then has to be disposed of. And today that's usually either landfilled, incinerated, or spread on land as a kind of fertilizer. But it's basically a byproduct of wastewater treatment. And so you can see that this kind of came about. It wasn't sort of designed all at once. It came about a little bit haphazardly. And the people who came up with each stage of this technology really didn't have in mind many of the problems that we are now facing 100 plus years later, going into the new century, which is, climate change, rapid urbanization, resource scarcity, of course, including water scarcity, but not limited to water scarcity, toxic pollution, chemicals that they couldn't imagine that we now make in abundance, plastic pollution, new kinds of disease outbreaks like antibiotic resistance, and inequality that we still want to address today. So this infrastructure required also today, we can see that this infrastructure, which required a high level of investments when it was installed in the past, is aging, and we haven't also consistently reinvested in the infrastructure, which is why the American Society of Civil Engineers this year in their annual report card gave the US wastewater infrastructure a D+. So it's really in poor shape. And other places, did you want to stop me?
So before we get too far away from the invention of the flush toilet, I promised this on Twitter, so I have to ask you. Tell us about Thomas Crapper. So is he in fact the person that to whom we should credit this invention? Because everyone's heard his name.
Not at all. He did not invent the flush toilet. The credit for the flush toilet goes to a number of different inventors, starting in the 1500s. But I won't give you those names. But Crapper is the name that's so associated with the toilet. But in fact, he was really just a marketing genius. He did patent some things regarding the toilet, but he made toilets, and he was really great at marketing them, and his name ended up on quite a lot of toilets. And no one quite knows for sure, I think, at least I couldn't find, why we call the toilet a crapper. Actually, the word crap, this is maybe too much in the weeds, but the word crap prior to his birth was associated with poop, but that's just a coincidence. But later it could be, someone has hypothesized that later, during World War II, maybe, American soldiers in the UK saw crapper on toilets, thought it was hilarious because of the word crap, and then brought that word back to the US, where crapper is a word associated with toilets. But apparently, if you do go to the UK, crapper is not a word associated with toilets. So,
I think that is probably one of the pieces of false history that everybody learns at some point. Probably you learn it from like your third grade child who, hears in somewhere at school that crap is associated with crapper and brings it home delightfully to try to shock you.
Yeah, well, there was a satirical book that was written by someone at some point that made this connection, that invented a false history of the toilet, in which Thomas Crapper was the inventor. And actually,
so he's actually the false hero of the piece. So I dragged you off track in talking about the civil engineering, but here's the thing that occurred to me when you were speaking was you referenced for all the problems that our infrastructure has now, you described what we have in the industrialized West as sort of the gold standard of sanitation. And so it occurs to me, you went all over the world to research this book. You have some very poignant episodes in it in which you are in much less resourced areas. And I'm wondering if there's anything you can say about the inequality in toilet access around the world globally, and maybe particularly what your reaction was as you saw some of the pit latrines and helicopter latrines and very different arrangements that people in different parts of the world had who would envy our gold standard.
Yeah. So there is quite a lot of inequality in toilet access. So this gold standard is something that one of the reasons I'm trying to sort of knock the toilet off its pedestal, so to speak, are the gold standard, is because it's something that a lot of places still very much aspire to have. And I think that maybe it's that aspiration doesn't take into account some of the realities of living with this infrastructure that we have and some of its limitations. But so just for the numbers, according to the statistics from 2017, hundreds of millions of people. I mean, this number is getting lower very quickly, but hundreds of millions of people still don't use toilets. They practice open defecation, so they may not have access to toilets for some reason outside of their control, or in some cases, there's cultural reasons that people prefer that. Quite a lot of people have really inadequate toilets. So when I was in Indonesia, I saw a very common type of toilet, which is known as a helicopter toilet, which is a toilet just over water. And this is a traditional type of toilet. And in other places, people might use buckets and then dump it into a waterway. So using just water as a like a river as a sewer, more or less. 700 million people have those kinds of inadequate toilets. 600 million have only shared toilets, so they don't have a private toilet. But that toilet might in fact be adequately containing the waste. Then 2.2 billion have what's known as basic sanitation, which sounds okay, but what I've learned is that that's often a problem as well. So those could be pit latrines, which can contain waste pretty well. I don't actually like to use waste, but let's say waste now, which can contain the pee and poop pretty well. But there's really a lot of cities that rely substantially on pit latrines. And even a good pit latrine in a city will fill up. And a lot of cities don't have adequate services for the emptying of those pit latrines. Either they don't have services, they don't have people who do that work professionally, they have informal workers who are maybe highly stigmatized, who don't use personal protective equipment. And then there might not be a place to take that fecal sludge, is what it's known as. So there's might not be a good functioning fecal sludge treatment plant, or maybe the workers don't bother to take it to the treatment plant. So all that sludge will end up in the environment somewhere. Sometimes they just will dig a hole and bury it right next to the house where the pit latrine is, just so the latrine will be empty again and available for use. And then there are places with sewers that don't actually have a treatment plant at the end. Or what I've found is that in many cases, or what I've learned rather, in many cases, those treatment plants at the end aren't working anymore. So wastewater treatment plant of this gold standard requires a constant source of electricity, or energy. It requires a regular source of chemicals. It requires experts to run it. And in a lot of places, these have been installed because it is this gold standard aspirational technology. But the money and the expertise and just the general context for the continuing operation of these plants isn't available, and so they fail. And so so that that is complete. That's also considered basic sanitation. So that's less. If you add all that up, less than half of the world population has safely managed sanitation.
Was that shocking to you when you went out on the road to research this book? Did you know the delta between some countries and others would be so wide?
I've been doing this for a while, so since 2013. So I mean, when it was always a little bit shocking, I think, especially. When you go to certain cities as a tourist, you don't really know what's happening to what you flush down the toilet. Like I was in Cap-Haïtien in Haiti, and I was in a nice hotel there, and the toilet flushes, and I just never knew what was happening because there aren't sewers there. So I think they had a septic tank. And then I went out into the field and went to an informal area and saw some pit latrines that people had that were in use. And they just were sort of open holes, not even with seats on them, with doors that didn't really properly close or lock. And it never failed to shock me, I guess.
So when I think there's a question that I want to ask now before we get into some more details, because it really underlies a bunch of these other questions that I have for you. And that is, I am really curious how you have dealt with, I guess, the ick factor of writing about. You even in the book talk about how you had to choose what words to use for the waste that we're talking about, whether you're going to talk about manure or shit or feces or pee and poop, which I think is what you settle on. But there's a lovely quote from an historian about halfway through the book in which she talks about how when you're discussing this problem, these issues, there's the actual sewage, but there's also a kind of cognitive sewage, is her phrase, that clings to the topic. So how did you deal with that? How did you think about about bringing forward a topic that a lot of people, as you say, toward the end of the book, really just kind of want to flush out of their minds?
Yeah, well, I mean, it is true, and this is a problem. I mean, I guess it's a problem. I mean, it's something that you can kind of use, shock value you can kind of use to your advantage as well. I mean, I can say for myself that after many years of working on this, that my sense of disgust toward the topic has dissipated. I don't really have a lot of those feelings anymore. But disgust is really an interesting emotion. The scientists think that possibly it's a part of a sort of behavioral immune system that in the past would have helped keep individuals and populations safe by giving them a sort of instinct to stay away from things that would make them sick. So in a way, it's very helpful to us, but in a way, when you're talking about innovation in toilets, it can be harmful because this cognitive sewage causes us to reject change, reject things like recycled wastewater, drinking, recycled, purified wastewater, which is the context for this cognitive sewage quote. So you have this clean water, but that it comes from sewage. your question is how did I
How do
deal
you,
with
yeah. So yeah, I'm interested how you
I
framed that for yourself so that you'd be able to defuse that cognitive sewage for anyone whom you hope is going to come to the book. And it
yeah
sounds like for you, you're not, this is something that you're so accustomed to now that you've kind of gotten over this problem yourself.
I have gotten over, and I think what I try to do is invite people in. So in the beginning, I talk about opening the lid on your mind, and I actually introduce a variety of innovators and talk about how they did it, how they opened the lid on their minds. So in one case, one of my favorites is a archaeologist who I got to know, who told me early on, actually in my reporting, probably back in 2013, that she had been studying ancient toilets for 20 years, but it was 20 years before she realized she actually had to imagine people sitting on the toilets that she was studying. She had to take away their privacy. She didn't want to invade their privacy prior to this. But she, once she was able to realize that she didn't need to afford privacy to imaginary ancient people, and she could actually imagine people sitting on the toilets and their behaviors there, she was able to make realizations about what they would have been doing on the toilets, and how long they would have been sitting there, and whether they would have been talking, or whether they would have been writing graffiti, or all of these different things, whether they would have been standing, to do certain things, that she hadn't really been able to think about before. So, I think what I tried to do was say, welcome in. There's a lot of insights here if you can join me on this ride. And then, of course, I use a lot of humor in the book. I didn't set out to write a terribly funny book. And though some of the joking, especially with the section heads, I ended up adding later. And I'm not sure everyone will like how many jokes I made in the book, because, maybe, it makes it seem like I'm not taking it seriously. But I think, I'm taking also a lead from experts like Jack Sim of the World Toilet Organization, who uses humor a lot to get into this topic. So I think that helps as well, just diffuse some of the tension of it.
So I'm fascinated by this concept that you've expressed from this archaeologist, that in order to adequately do her research, to really understand the milieu she was studying, she had to invade the privacy of the people who thousands of years before would have used these privies that she was studying, because that really is, I think, at the heart of some of the discomfort that we feel in talking about pee and poop and toilet practices. Is it's not just our hardwired disgust for the substances, but it's also that for most of us, it's a profoundly private act. And and actually in more private in some other parts of the world, maybe where you are, than in the US. Every once in a while you'll see one of those BuzzFeed sort of listicles about what are Europeans surprised about in America, and vice versa. And Europeans reliably say, when you go into a public toilet in America, you can actually see your feet. The doors don't go floor to ceiling. We would never allow that. So the sense that privacy is being invaded or has to be invaded in order to make a difference in this space is a really, really interesting concept. So let's talk about some of the things that would change that space. Persistently throughout the book, you bring forward these just enchanting sketches of different innovators who are working on different aspects of transforming the toilet, as in your title, changing the way waste is processed, changing what we do with it afterward, changing the actual form factor of the toilet. And I'd love it if you'd talk to us about some of just sort of your favorite innovators, the people whom you found most interesting, or the projects that you thought had the greatest promise, or the greatest inherent intellectual challenge.
Yeah. So I let's see. I'll get right into it. I just want to acknowledge that many cultures, through history have reused pee and poo. So this isn't a new idea, but this gold standard kind of moved us away from that. Although there are uses for the byproducts of that treatment, water and the solids. But there's a lot of it, but that system wasn't designed with reuse in mind. And these systems get easier when you do design them with reuse in mind, sort of from scratch. And so I've already mentioned Haiti. So why don't I start by just talking about this container-based sanitation program that I saw there. Container-based sanitation is a concept that is really gaining a lot of traction around the world. And one of the leading programs is in Haiti, known as Soil. And I described a toilet that I saw there. Some people don't have private toilets at all, and they might use plastic bags if they have to. And but Soil provides a private home toilet that has a container in it, a pail, and it's like you use it, if you fill it up with a dry material and then close it up, and a service comes and collects it. So instead of flowing underground, it goes overground in trucks, and it goes to a composting center. And this is something that people have shown that they're willing to pay for. And it provides compost for Haiti's depleted soils. But one of the interesting things about container-based sanitation is that there really is a lot you can do with this. So with this material, which is, in this case, it's just the poop. And one of the things they're experimenting with in Haiti and in more of these systems around the world, in Kenya in particular, is black soldier fly technology. So they're feeding the feces to the maggots of a special fly called the black soldier fly. And this is a great fly for this purpose, because it doesn't eat when it's an adult, so when it's flying around. So this is really dangerous about flies, that they will flit from poop to your food, and then it'll transfer pathogens that way. But in this case, this fly won't do it. And then once the maggot is nice and plump, it can be fed to fish and chickens, and it can replace fish meal in animal feed. So it's a really interesting concept. It's like a new take on night soil, if you know what that is. It's an old system, but it's new hygienic take on it, and it's really works in these kind of slum scenarios. And I think maybe there's something to be taken away also for other contexts as well. We'll see if it transfers. It's really good in conditions where you have a lot of flooding, for example, because you can just lift the toilet up and it won't get wet. It won't flood, and sewers, when there's floods, that flood water gets full of sewage because of the sewers under the ground. So that's only the poop, but there's a lot you can do with only pee. I've seen not only fertilizer, so pee has most of the nutrients actually in our excreta, but it has very few of the pathogens. It's got very few pathogens, so it's a really good substance to work with. And phosphorus in particular is interesting because phosphorus is mined and there is a limited amount. And but one of the problems is that getting pee separate from poo and water has been really difficult. Urine diverting toilets haven't been very easy to use, and people haven't wanted them. But one concept that's people have a lot of good things to say about is a new toilet out of Austria that's been in development for a while that uses a concept called the Teapot Effect to, so if you think about pouring a teapot, the some water might come out instead of going into your cup. It will go along the side of the teapot, sticking to the side. Well, this toilet on the inside of the toilet uses that physics property to bring the urine separate from the poop into a little hole, and it can be collected there. And so that has, and it doesn't, and the toilet itself just looks like a toilet that anyone would use. So it doesn't require users to make any change to their behavior, which can be really helpful in change to toilet technology, because asking people to change their toilet habits has proven to be extremely difficult. They're very sticky habits.
We should probably talk about that. Is that as much as it sounds like, as much as there's broad endorsement across the world for needing and wanting to change how we do toilets and sanitation and the big project of waste management. When it comes down to actually putting to a single person sitting on a single toilet or standing at a urinal, there's a lot of resistance. We're very attached to the ways we first learned to pee and poop. So what did you learn about the psychology of getting people to adopt new form factors of toilets, which is a little different from the innovation problem of having someone come up with a new toilet to begin with?
Yeah, I think, what I learned is that it's hard, and that projects that don't have users on board from the beginning are going to fail, or inclined to fail. So the projects that seem to work are projects that meet people where they want to be. So that's why I think this idea of providing a toilet that separates urine but doesn't ask people to make changes to their behavior will work better than the urine diverting toilets of the past that require people to kind of aim, or do things, in an awkward way. And so these soil toilets, you're asking people to use a sort of different type of toilet from a pit latrine that they might be used to. A young woman that I met there said that, it was weird for her at first to use this toilet and to have to put this cover material over it, but that she got used to it. And it was something that their family really wanted because it was a private toilet in their home. And so, for that reason, they coveted it. And experts have found that people want toilets that have this what's the word, that are sorry.
Let me jump in and I'll ask you a question, because there's something that's come in from one of
one of the folks
I'll think
listening. Of the word and then I'll get back to that.
One of the folks listening has proposed a question that actually ties together several of the threads we've been talking about. You mentioned Bill Gates early on and the involvement of NGOs in sort of toilet reform around the world. And we're just now talking about the problem of adoption of new technologies. So Rachel asks that as she works on childhood diarrhea around the world, she's seen latrines of all varieties that have been sort of like dropped off by global NGOs. They aren't adopted, and they're just kind of abandoned, or they're not maintained. And have you encountered that? And what do you think both about that problem, and are there ethics surrounding in-use latrines that were sort of institutionally abandoned? Is there something we can do around that, around global health efforts?
Yeah, this is a known problem. I don't talk about it really in depth in my book, but I think it's also kind of related to this idea of building of these aid organizations building these wastewater treatment plants, basically dropping them in and leaving it to the countries to kind of figure out how to keep going with the operation of these facilities, and then they fail right away. So there's a lot of failure around toilets and sanitation interventions, and there's a new conversation happening in the field, around being really open about why these failures happen. And I think that they happen for really a lot of reasons. But often it's because they are not suited to the local context. So, or they're hard to keep up. So, I've heard complaints that a lot of these toilets, after a year, they're stinky and gross. They look great when they first installed, but they're stinky and gross after a year. So people go back to doing what they were doing before. Anyone would. I just saw an example the other day where someone reported that toilets were installed in a community, but they were poor flush toilets. So you just need a little bit of water afterward, but there wasn't a consistent source of water in this community. They had to haul their water from somewhere. And so people didn't have the water to use the toilets. So they just went back to doing what they were doing before, which was open defecation, and also using other toilets that they were using. So I think that there's no one reason that these toilets fail, except that they were poorly designed interventions that were done without the input of the community. And that's one of the reasons. I mean, I in my book, one of the points I want to make in the book is that we need, instead of this one gold standard, we need a really wide variety of gold standard toilets, good ones, that are suited for a lot of different conditions, environments, cultural contexts. And people need to be involved in making the choice about what kind of toilet they want to use. Otherwise, that's going to happen.
So let me jump on this question of the design problem, because one of the places I think where we most experience this question of what's appropriate toilet design and what's appropriate to a site or to potential users in North America is in the question of urban public toilets. So this is kind of allied to, but separate from, the question of global toilet access. But then, in so many cities, there have been ferocious fights over whether public toilets are going to be available, whether it's for tourists or for gig workers, or as one of our participants has asked, for people who are unhoused. I grew up in England, and I vividly remember my nanny saying to me one day when we were out in London, "Oh, do you want to spend a penny?" And I thought she meant we were actually going to spend money. And it took me quite a while to figure out, as a silly American child, that what she actually meant was we were going to a pay public toilet. We were going to put a penny in order to make the stall door open. So do you have any thoughts from your experience in researching the book about this problem of acceptability of increasing urban public toilet access, particularly in North America?
Yeah, so my understanding of why there's like a crisis of public toilets in the United States is that there were actually quite a lot of pay public toilets, in the middle of the 20th century. But in the 1970s, it became clear that they were sexist, because women had to pay, but the urinals were free. And this, if this sounds absurd, this is actually quite common in Austria, where I lived for a while. So this is still going on in the world. And feminists in the 1970s said, "No way, this isn't right." And so they said, everyone should be able to have free toilets. Why should women pay and men go for free? The problem was then that the cities didn't want to pay to maintain these toilets, and they kind of fell by the wayside. And so then there weren't as many, and now people use like Starbucks as the public toilet. But the problem with using cafes as public toilet is that it's really for people with privilege who can go into restaurants and say, hey, can I use your toilet? And there was even a case a couple of years ago where 2 Black men got arrested in a Starbucks, after which Starbucks made a policy that they would let anybody use the toilets, because these are two young Black men who were just waiting for a friend and hadn't ordered anything. And then someone called the cops on them for asking for the toilet.
Which really shows us how this problem that we're talking about of access to toilets is really a problem that has many axes, that touches culture, that touches sexual equality, that touches entrenched racism in society. Have there been any? There's a thing that you mentioned in the book about there being sort of an iconic public toilet, the loo in Portland. Can you tell us about that?
Yeah, there's a new concept that's just like, this seems to be proliferating, like even as we speak. It's called the Portland Loo. It's a public toilet that was designed in Portland with this sort of defensive design. It's very hard to put graffiti on it. It's very hard to destroy. It's very hard to do anything in there other than use the toilet, because it's got, you can kind of see through the bottom and the top. So you can't, it's like, it's not very welcoming for other uses other than using the toilet. Now, I would say that people do need to use toilets for things other than peeing and pooping, and maybe we need to also take that into account in our public toilet design. However, we do want to also make sure that public toilets remain available and open for peeing and pooping, and aren't used for illicit activities, for example, in there exclusively. And so this Portland Loo is relatively affordable, doesn't cost a lot to maintain. And it's now appearing, in cities all over North America. And it does have a kind of iconic design. It's a single standalone toilet that doesn't have a gender designation either, which is nice.
So one of the folks who's listening asked specifically about toilet access for people who are homeless or unhoused or unsheltered. Yeah. And this must intersect with the problem of whether to allow public toilets. Do you have any thoughts about that particular aspect of toilet access?
Yeah, I think the Portland Loo was really designed with that in mind, because it can be open 24 hours. My book doesn't really address that too much, although it does acknowledge that there have been outbreaks in unhoused encampments, in homeless encampments, due to lack of proper hygiene and sanitation there. And so it's really, really important to find solutions. I also have seen a growing trend toward, you could have a pay toilet again. So there are experts who are advocating for having pay toilets, but having a kind of toilet stamp system for people who wouldn't be able to afford them, for having public toilets with attendees there who help keep them clean and who make them kind of more welcoming, and also adding on other services to toilets, like a cafe on the side. So instead of having the Starbucks be the toilet, have the toilet be the Starbucks in a way. So you can have other services on the side that help pay for the toilet. So that's a model that's getting some traction in India, and a particular kind of toilet model for women. And I think that, as long as it's public and it's clear that it's meant to be for everybody, and that, people are trained, the attendance is trained in that it could be a really good solution.
So we're running up to the top of the hour, and there's two more questions that I want to ask you.
Yeah, sorry.
I want to be sure that they don't get away. So the first is, you were finishing up this book as the pandemic began last year, and both in the epilogue and also in a piece that you wrote recently for Wired, and thank you for that, because I work for Wired, though I was not aware you had written it at the time. I just found it, and it's fantastic. You talk about how weirdly there were many connections between this problem you were exploring of toilet access and toilet design and toilet reform and the COVID pandemic. And I would just love to hear you talk for a minute about what all those points of connection were.
Yeah. Maybe everyone had this experience that the pandemic kind of like, I mean, I know for you, Marion, it's the case, but that like whatever you were interested in, you saw all these connections because it seemed to touch everything. But it really, one of the first things that we found out was that COVID is, or the coronavirus is shed in poop, and I thought, oh my gosh, it's shed in poop, and but poop didn't turn out to be dangerous. With regards to this, but it could have been. And so I immediately started worrying about, oh my gosh, all this raw sewage in the environment that I now know about, these leaky sewers, these places without proper sewage treatment. This is going to be, terrible. And so then that it sort of brought that to my attention. And then at the same time, I had just finished, when the pandemic started, I just finished the section of my book on wastewater surveillance and epidemiology. And I thought, oh, this is going to be great. So we're going to be able to monitor our sewage to see if this virus is coming our way. And that was something that, in fact, scientists did start to do right away. That's still developing.
And then there was the toilet paper problem.
Right. And there was the toilet paper problem, right? Like, right. Of course, right as I was, my book draft was due April 1st. And as I was finishing up, it was like the toilet paper was flying off the shelves and people were ordering bidets, and I thought, this is crazy, because I had just finished writing that like Americans would never be interested in bidets. I mean, I didn't write that, but, skeptical that Americans would be interested in bidets, but then all of a sudden everyone seemed to be interested in a bidet. And so it made me rethink that a little bit. And, and I had all of these ideas about what people could do other than use toilet paper. And then at the same time, something that you might not know is that wastewater workers in the U.S. are close to retirement. So there's like a lot of these expert wastewater workers in the U.S. are quite close to retirement. There's something coming called they're calling a silver tsunami, that there's going to be a wave of retirements. And when it became clear that the coronavirus was really viciously attacking people who were older, I worried, how are our toilets going to keep working? And it turned out that utilities were worried about that too. And some of them even locked their gates with their workers inside, just to make sure that everyone was safe and that their plants could keep operating. And then I was worried about the vulnerability of people with poor sanitation, because poor sanitation usually intersects with other disease and poverty. And so, you could probably guess who was going to be hit hardest by the pandemic. And that turned out to be quite true. And public toilets closed. And so everybody all of a sudden was in the same position as those who normally wouldn't have access to any public, not just public toilets, but restaurant toilets that you would use. So everyone sort of got this experience of not having any toilet to use when outside the house. At
the same time as there were many more Amazon workers out on the road because no one went out shopping. They all ordered everything on Amazon. So that must have made much more clear the problem for gig workers, or for people who don't work in offices, that the need of underlining the need for public toilet access even more than before.
That's true. And no one was going to let them in the house to use the toilet. So I don't know what they did. I mean, there's stories, but
So
But
I want
that's
to ask you one last question, and that is, this author Q&A series comes out of work that I do at Emory on health communication and health storytelling and science writing, and I think there may be some of my students in among the participant list. So a thing that we think about a lot is how do we weave storytelling through messages that we're putting out to communicate science, to communicate health concepts. And journalism and a book in particular are extended engagements with both the minutiae of a topic on a very technical level and also with storytelling. So I'd love to hear just a few thoughts from you about how you actually approach telling this story that you'd been immersed in for so many years at the point at which you wrote the book, how you identified your characters, how you figured out when you were going to be able to just use statistics and when you knew you need to find a person to embody the story that you wanted to tell. Are there any reflections you have about your communication challenges in doing this?
Yeah, that's a big question, isn't it? With this book, I was looking for, I was taking a solutions journalism approach, which is about reporting on how people are responding to problems. So I'm not just going to say these are all the problems, but I want to say these are the people who are responding to the problems. And that allows me to tell the stories of the people who are doing the responses, the people they're affecting in some cases, and also then to talk about the problems in that context. So, and that allows me also to talk about the history, how we got where we are, and what the current situation is. And so I was looking for examples of promising innovations that I thought would still be around when the book got published, because I've actually had a lot of experiences in my reporting on projects that then a few months later didn't exist anymore because there are so many failures in this area. So I've gotten a bit of a better nose for that. I think all the projects that I reported on are still in existence. And I was also looking for people who had interesting stories, although that wasn't my primary goal. I figure if a project is doing well, and if it's about toilets, there will be something interesting to say about it. Although some of them are quite interesting, but the solutions journalism approach really would prove to be quite useful in this as well, because it also allowed me to talk about the challenges that were faced. So there's an inherent sort of tension when you report on how someone's responding to a problem, and it was really important to me also to talk about the limitations of each of these approaches, so that people have a realistic understanding of where they might work and where they might not work, and how hard it is.
I think probably the idea of solutions journalism is going to be an unfamiliar concept to a lot of the people listening, because this is not primarily a journalism audience. But I love that you took that approach, and I wish more people knew about it. And I think, I hope everyone will go out and buy the book, which, as I said, is fantastic, because at the end, you actually do give you not only introduce us to all these people who are working on various aspects of solutions to this problem around the world, but you give sort of a laundry list for your readers of, even if you are someone living in a highly resourced society, even if you are not an engineer or someone who has access to a CAD program, here are things you can do to actually make this better. Look for NGOs, look for projects in your area, things that can help people contribute to the solutions. And I think that's a great aspect of the book, and it doesn't happen very often. So thank you for doing that.
Thanks. Yeah, that was kind of part of my inviting people in. I do think, since everybody poops, every story has a toilet angle, and whatever skills you have, you can, if you want, make a contribution to this, to helping solve solve this problem, because it's all around you. So no matter what your interest is, you don't have to be like an engineer. No matter what, I'm not. So whatever your interest is, there's an angle there for you. So that was also, trying to bring it back to why. Yeah, bring it back to people and help and invite them into the topic a little bit more.
So those are great words to end on. So thank you so much. Thanks everyone for attending our author Q&A series, sponsored by Emory University's Center for the Study of Human Health and the Georgia Center for the Book. You've been listening to me, Maren McKenna, talk to Chelsea Wald, author of the brand new and fantastic book, Pipe Dreams: The Urgent Global Quest to Transform the Toilet, which is from Avis Press, which is an imprint of Simon & Schuster. It's been out just a couple of weeks now. Avid Reader Press. Excuse me, I'm so sorry.
No.
Thank you all, and thanks, Chelsea. And I'm sorry we kept you up so late, but thanks for this great session. I really appreciate your being here.
Thank you so much. And thanks for putting up with my sort of quirky midnight brain, but I think we pulled it off.
It was fantastic. So long.